Good afternoon, everyone, and thank you for joining us for this pre-release webinar for CCO SEER Stat Package Release 11. My name is Anik Anam, and I'm an epidemiologist with the CCO Surveillance Program and the project lead for this work. I'm joined by Zainab El-Masri, who is our Senior Specialist in Knowledge Dissemination and Evaluation and has been co-leading this work. And finally with me, as you heard from earlier, is our Director, Dr. Pritish Dey, who I will now pass it over to again for some opening remarks.
Okay, thanks, Anik. So welcome again, everyone, to our pre-release webinar for CCO SEER Stat Package Release number 11. This is the first time that we've offered a webinar before releasing a new version of SEER Stat. And the reason for doing that is because we have some really exciting enhancements to the tool that we wanted to highlight for you, and you're going to hear about those in just a few minutes. As always, CCO SEER Stat Package really reflects our efforts to make cancer data more accessible to our partners and to other stakeholders in the health system. Many of you on the call today will probably be seasoned users of the SEER Stat Package. Others will be new to it, and there might also be some of you who are calling in to learn more about how this tool can be relevant to your work. So we welcome everyone. The CCO SEER Stat Package has had a long history in Ontario, beginning with the first release in 2001. And with each release, the package has gotten better, with more years of data, more types of data, and more resources to help users make the most out of the package. And many of these improvements have been made with input and participation from you, our users, like some of the ones that you see listed on this slide here, who helped out with release number 11. So we thank you for your continued interest and advice on ways that we can make this package more relevant, especially now as more informed decisions are needed based on evidence and good quality data. So the team here at CCO has spent a tremendous amount of time on this latest release, so we hope you find it useful. And as always, we welcome any feedback. I'd like to turn it back to Anik to take you through today's webinar.
Okay, so for those of you following along with the deck, we're on slide 3 that lays out the agenda. So I'll start today by providing a bit of background about the CCO SEER Stat package, and then I'll pass things over to Zainab to talk about the evaluation that was done for release 10. And then I will spend the bulk of the presentation talking about release 11. I'll go over what is included in the package, focusing on the data enhancements in this new release, and actually demonstrating how to use these new functions in SEER Stat. We'll end off with some next steps with regard to the disclosure process for release 11, and finally we'll open up the line for questions. So to give those of you who are unfamiliar with the package a little bit of background, SEER Stat is a statistical software program that was developed by the U.S. National Cancer Institute as part of the Surveillance, Epidemiology, and End Results, or SEER, program, and it was designed to analyze cancer registry data. The CCO SEER Stat package, which is prepared and distributed by the CCO Surveillance Program, contains 3 components: a copy of the SEER Stat software, databases containing Ontario cancer data at the Provincial Local Health Integration Network, or LIN, Public Health Unit, or PHU, and Census Division levels, as well as user support materials, including a detailed user guide, FAQs, and training materials to assist users. The data files distributed with the CCO SEER Stat package are de-identified data from the Ontario Cancer Registry, and for the recent releases include historical Ontario cancer data from 1981 until the latest available year of complete incidence mortality data. The purpose of providing our cancer registry data in this format is to enable and support analysts across the province to perform their own cancer burden analyses within their jurisdictions for the purposes of health system planning, management, and research. So as Pritish mentioned earlier, CCO has been releasing Ontario Cancer Registry data for use with SEER Stat software since 2001. There have in fact been 9 external releases of the CCO SEER Stat package to date, and the information on this slide here is also available on our website under What's New and Past Releases. The latest version, Release 10, was released in November 2015 and contained Ontario cancer data from 1981 to 2012. As British said, each new release came with improvements in terms of the data offerings as well as user support. In addition to that, Release 10 marked the first formal evaluation of the CCO SEER Stat package, and I will pass things over to Zainab now to talk a little bit about the evaluation for Release 10 and the findings.
Thanks, Anik. So as Anik mentioned, we conducted an evaluation of Release 10. We did this in 2017, and our goal was to assess the strength and limitations of the package from the perspective of our external users, and we of course did this to inform future releases. So in terms of our methods, we conducted stakeholder consultations through an online survey administered in the summer of 2017. We reviewed traffic on our website using our Google Analytics account. We profiled our approved users to understand who they were and what organizations they came from. And finally, we conducted an environmental scan of published works using SEER Stat. In this case, we looked at any release, not just Release 10. And for those following along on the line, just to let you know, we are on slide 7. So in terms of our findings, they were quite positive and reinforced the value of the package, which is being used for a variety of purposes. On the right here, you can see we have a screenshot of an infographic that summarizes the findings of the environmental scan, which picked up 45 products that were produced using the CCO SEER Stat packages. The evaluation also highlighted opportunities for enhancing the package, and these findings can be grouped into 4 themes, including data enhancement, user recruitment, training and support, and peer mentorship. So in terms of data, there was interest in additional data elements, with 70 to 80% of our survey respondents expressing interest in survival and prevalence, and 100% of survey respondents expressing interest in health equity measures. Our profile of users showed that although the majority were from public health units, there was a spread of users from other institutions, which told us we could more actively promote the package outside of public health units. And although 100% of our survey respondents indicated they used our existing user support materials as their go-to for questions, 80% of survey respondents wanted additional training, with the majority preferring a webinar followed by online self-directed learning. And finally, there was interest in peer-led training, with just over a third of survey respondents expressing interest in peer mentorship. So our evaluation findings led to recommendations that informed the expansion of the package for Release 11.
So many of you likely saw the flyer that's on this slide, which highlights the improvements that were the focus for Release 11. The first being to enhance the data offerings by expanding the analytic functions available to users, as well as adding new data elements for analysis that were not available in past releases. Although, as Zainab mentioned, there was a lot of interest in having health equity measures available through the SEER Stat databases, that is something we will be looking into for future releases and is not included in Release 11. We also wanted to improve our user support by creating our own training videos with Ontario data-specific examples in order to meet users' needs for self-directed learning. The next step to augment the user support we're providing is to look into peer community support, and I've added an asterisk to this as this is something we're planning on rolling out following the release, hopefully sometime early next year. And finally, as part of this expansion, we wanted to improve our user engagement. So for the first time, we conducted beta testing by inviting our existing users to participate in testing both the new data files as well as the new training videos while they were in development. So now getting into the specifics of what Release 11 includes. In terms of the data and functions, this release comes with cancer incidence and mortality data for the years 1981 up to 2016, for the same 4 levels of geography as we have had in previous releases. In terms of the types of analyses that are possible using the package, as with the previous release, Release 11 can be used to produce incidence and mortality counts, as well as crude and age-standardized rates. What's new for Release 11 is that we have now enabled the survival and limited duration prevalence sessions. These sessions use data contained in the incidence databases to produce survival and prevalence statistics, which I will demonstrate shortly. And finally, we have also included a new variable for analysis, which is stage at diagnosis. So before I get into the demo, I want to spend a little bit of time talking about these new elements, their purpose at a very high level, and what information is available specifically in Release 11. So as many of you are likely to know, survival statistics are a key measure for assessing the burden of cancer at the population level. It helps us answer the question of how a cancer diagnosis affects the longevity of people at the population level. It's particularly useful to examine cancer survival between different jurisdictions, as this can highlight areas of improvement with regard to cancer treatment and control at the local level. So using the survival session in Release 11, we can produce two types of survival statistics. The first is observed survival, which is the probability of surviving all causes of death among people with a cancer diagnosis. This statistic just describes the survival experience of people with cancer and is a simple proportion, that is, the number of people with a cancer diagnosis who are still alive at the end of an observation period out of the total number of people with the cancer diagnosis at the start of that period. More often, what we want to know is the impact of cancer specifically on survival. That is, we want to know the excess mortality that is caused by a cancer diagnosis. This is called net survival, and using Release 11, we can produce a net survival measure called the relative survival ratio, which describes cancer survival in the absence of other causes of death by taking the ratio of observed survival among people with a cancer diagnosis to the expected survival among people matched on age, sex, and calendar year in the general population. The relative survival ratio accounts for other causes of death or background mortality by using Ontario life tables to determine the expected survival of comparable cancer-free people in the general population. So prevalence is another key measure for assessing the burden of cancer at the population level. To question how many people are living with a cancer diagnosis. Cancer prevalence can be used to inform the allocation of diagnostic, treatment, and care resources. In the limited duration prevalence session in Release 11, we can produce prevalence counts specifically for limited duration prevalence, which is the number of people with a past cancer diagnosis who are alive on a specific date and whose cancer diagnosis occurred within a specific time frame prior to that date. Different lengths of this time frame can be useful for different reasons. Shorter-term prevalence statistics, for example, 5 or 10-year prevalence, are useful for measuring health system resource impact, since primary treatment, clinical assessment, and close follow-up occur during these years following diagnosis. Longer-term prevalence statistics, such as 30-year prevalence, tend to capture long-term survivors and can be used as a proxy for all current survivors of cancer, or lifetime prevalence. Long-term prevalence is useful for informing long-term care needs and understanding patient outcomes. Lastly, I wanted to give you an overview of the stage at diagnosis data available in Release 11. We added this new variable to the incidence databases, as the ability to produce cancer burden statistics by stage is important for assessing the effectiveness of organized screening programs and also helps with planning, evaluating, and enhancing the quality of the cancer system in general. So the stage at diagnosis variable included in Release 11 has information on stages 1 to 4, as well as unknown stage, which are cases that were staged, but that the stage group could not be identified, and not applicable, which reflects cases that were not staged. The table here provides a summary of the stage data available in Release 11 in the incidence databases specifically. There is limited data, stage data available for 2007 to 2009 for breast, colorectal, lung, and prostate cancers. From 2010 onwards, complete stage data are available for breast, colorectal, lung, prostate, and cervical cancers, as well as a few other cancer types, as you can see in the table. A version of this table has been added to the updated user guide included with Release 11. So I'll move on to the demo now. I'll be going through two quick examples that demonstrate these new features in Release 11. I do want to note that these examples are some of the most complicated types of analyses possible using the SEER Stat software. So for those of you joining today who are new to the CCO SEER Stat package and to the SEER Stat software in general, I just want to note to you that the training videos and user documentation do cover all of the introductory material. So the first example will demonstrate survival by stage, where we will produce 5-year relative survival ratios for colorectal cancer in Ontario for the 2010 to 2014 period. The second example will demonstrate a prevalence analysis, where we will produce 5-year limited duration prevalence for lung cancer by Lynn as of January 1st, 2017. So let me go ahead and switch over to the SEER Stat software. Okay, so I have both the survival and limited duration prevalence sessions open here with all of the selections made for each example. I'll start with the survival example. So first, I opened up a new session by clicking on the % symbol in the ribbon at the top, which opened up a new survival session window. As with all of the other sessions in SEER Stat, the survival session starts with the Data tab, where we select the database we want to use for the analysis. As you can see, we can select any of the incidence databases for survival analysis. I have selected the Ontario Cancer Incidence Database, since we're interested in relative survival ratios for Ontario, but survival statistics can be produced for all 4 levels of geography. The next tab, which is the Statistic tab, I've chosen the type of survival measure, which is relative survival, with the remaining options left at the default selections, the Ederer 2 method for calculating expected survival and the actuarial method for calculating observed survival. So here I'll just pause and point out that the SEER Stat Help Guide can be easily accessed during your session and contains detailed descriptions and links with more information for all of the options in the session. So for example, now if we wanted to get more information about these various methods for calculating expected survival, you could go to Help in the topmost ribbon, click on Content and Index, and then navigate to the Survival session, where we can see the Statistic tab, which explains all of the options within the tab, including the cumulative expected survival methods. And as you can see, there's a description and a couple of references as well. So in the next tab, which is the Selection tab, where we reduce the databases to only the cases we're interested in for our analysis, I've selected the cancer site, which is colorectal or colon and rectum, the years of interest, which is 2010 to 2014, and here I've also selected cases that are staged 1 to 4, so that my output does not include any cases with stage values that are unknown or not applicable. Also, at the bottom of this tab is a section called Multiple Primary Selection, and here I have chosen first primary matching my selection criteria. And again, there's another quick link here, which takes you to the section of the SEER Stat Help Guide that has more information on multiple primary selections for the survival session. So in the next tab, which is called the Parameters tab, this is unique to the survival session. This tab is where we specify all the details for the survival statistic, in our case, the relative survival ratio, with regard to how it's calculated, the time interval, and which parameters we want displayed in our output. For the survival calculation, we have selected pre-calculated duration with survival months calculated from complete dates. I've also set the study cutoff to December 2016, and I've also selected 60 months as the interval for the survival statistic, which is 5 years for the 5-year RSR. I've opted to only show the relative survival ratio in my output by checking relative. And then in the next tab, which is the table tab, where we specify the format of the table that will be outputted in the analysis, I've included stage at diagnosis as a row variable, so that the output table shows the 5-year RSRs by stage, with the different stage groups appearing in rows. And finally, in the output tab, I've added a title for the table, which is optional, but helps to organize the results of multiple analyses. So at this point, you would click on the lightning bolt icon to run the analysis. I ran the session earlier so that I have the results ready, which I can show you here. And this is the output that shows the 5-year relative survival ratios for colorectal cancer in Ontario by stage for 2010 to 2014. Okay, so I can move on to the next example, which is a prevalence analysis. As I said, I have the limited duration prevalence session open here, which I created earlier by clicking on the P icon at the top ribbon, which opened up a new session window. This analysis will be by Lynn. So in the Data tab, which again is the first visible tab in the session window, I've selected the Ontario Cancer Incidence with Lynn database. In the next tab, which for the limited duration prevalence session is the Selection tab, I've selected lung cancer cases in the bottom section here. Since this example is not looking at prevalence for a specific age group, I've left the first section blank. The analysis is also for both sexes and for all LINs, so I've not specified sex or geography in the second section. Rather, we will be stratifying the analysis by LIN later on. Similar to the survival session, the limited duration prevalence session requires multiple primary selection. I have selected to include in my analysis all tumors matching selection criteria, 1 tumor per statistic, which means I've selected all lung cancer tumors, regardless of whether they were first or later primaries. However, only 1 tumor per individual will be included in each prevalence statistic calculated. So this means we will be looking at person-based prevalence and not tumor-based prevalence. And again, there is more information here in the Get Details quick link about multiple primary selection for the limited duration prevalence session. So in the next tab, which is the Statistic tab, I've chosen the prevalence date, which is January 1st, 2017. I've limited the prevalence duration to 5 years, and I've selected to display counts of prevalent cases. Next, in the Table tab, since I want to see the 5-year lung cancer prevalence by Lynn, I have included Lynn as a row variable for the output table. The next tab is called Survival Cohorts and is unique to the limited duration prevalence session. This is where survival is estimated for cases that were lost to follow-up before the chosen prevalence date. This is done by assessing the observed survival of similar case cohorts, which I have defined here by Lynn. This is one of the more complex pieces in this analysis, so for more information about the options for this tab and how they can impact the analysis, you can refer to the section on survival cohorts for limited duration prevalence in the SEER Stat Health Guide, which is again available through a quick link within the tab. And finally, in the Output tab, I've added a title for the table. At this point, again, you would click on the lightning bolt icon to run the session. And I have already run the session, so I have the results ready. So this is the output, which shows the 5-year prevalence for people with lung cancer as of January 1st, 2017 by Lynn. Okay, so we switch back to the presentation. So although those two examples went through all of the various options and selections in these new sessions very quickly, there is a lot more information that I didn't cover that is available through the user support resources included with Release 11. And we highly recommend that you go through them when starting these analyses on your own. With Release 11, you will be provided with updated user documentation, including the user guide, quick start guide, and FAQs. For those of you who have received the CCO SEER Stat package in the past, you'll know that you receive the user documentation at the same time as you receive the data files and software as part of the package. The only document that is available publicly on the website is the FAQ document. As I mentioned earlier, we also have new training videos available on our website, which you will find on the right panel of the landing page under Supporting Resources. These new training videos cover an orientation to the SEER Stat software and Ontario data files included in the package, as well as basic incidence, mortality, survival, and prevalence analyses. As always, you can also refer to the SEER Stat tutorials available on the SEER website that go into a lot more detail, the link to which can also be found on our page within the Supporting Resources section.
Hi everybody, this is Zainab again. So in terms of next steps, we will begin accepting requests for the package this Thursday, June 20th. So starting Thursday, you can visit the CCO SEER Stat website to assess your eligibility and download the Release 11 confidentiality agreement. So although one agreement can be used by up to 5 users at the same institution, all requesters need to sign the agreement. Once the form is submitted and your request is approved, we will give you specific instructions for accessing the package, which will start by calling into the CCO service desk. As we are expecting a high volume of requests in the first month or so, you may be asked to call in at a specific window of time. So to wrap up, as we mentioned at the beginning, we have been recording this webinar and we're aiming to post it on the website within the next couple of weeks. We have put together a very brief survey to assess this webinar, and we would appreciate it if you can fill it out. I will share the link very shortly through the Skype chat. For those who cannot view the Skype chat, please email us at the CCO SEER Stat mailbox, and we will provide you with the link. And with that, we will open it up for questions. If you'd like to ask a question over the phone, please don't forget to unmute your line. Alternatively, you can post a question through the chat box. Okay, so we have a question through the chat box. What if we need more than 5 users to have access? In that case, the first 5 would just fill out one form, and then additional users would fill out another form. Okay, so if there's no more questions, like we said, we would really appreciate it if you could fill out the survey. It's quite brief, and as you can see, we really do take your feedback quite seriously anytime you provide it to us. And as always, you can email us at the CCO SEER Stat mailbox for any questions. And I realize some of you were a bit challenged in connecting to the Skype, and therefore you couldn't completely see the demo. So like I said, this has been recorded, and it will be posted on the website. Okay, thank you everybody for your time.